Hello, my name is Samar Akiki and I'm a psychologist at Maudsley Health. In this video, I'm going to talk to you about panic disorder. So, let's talk about Tim. Tim had his first panic attack at the age of 19. He had a presentation at university and got really anxious beforehand. He started experiencing accelerated heart rate, sweating, trembling, sensation of shortness of breath or choking. He felt dizzy, nauseous, and had a feeling of unreality. He thought that he was having a heart attack and rushed to the emergency room. After the doctor examined him, he told him that he did not suffer from any medical condition and that it was a panic attack. However, Tim was still dreading having those attacks 2 months later, and he developed a panic disorder. A panic attack is the onset of a brief, intense discomfort or anxiety, where a person experiences an intense fear of losing control, going crazy, or even dying. These attacks occur out of the blue and typically only last a few minutes. Clients who suffer from panic attacks often present themselves to the emergency room fearing for their health. However, panic attacks are not due to a direct effect of a substance or to a medical condition. Panic attacks might be very scary, especially if you don't understand what's going on in your body and you really think you are in danger. Thus, certain people might develop what we call a panic disorder after one or recurrent panic attacks. A panic disorder is when the person starts fearing having a panic attack for a period of 1 month or more and start developing significant maladaptive behaviors such as hypervigilance, avoidance, or safety behaviors. Hypervigilance is a state where the person is constantly assessing potential risks around him as if he is continuously in danger and needs to protect himself. Let's go back to Tim. Tim was scared of having another panic attack. He started noticing when his heart rate got elevated each time he was walking, climbing up the stairs, or did any type of physical exercise. He started constantly monitoring his heart rate on his watch during the day. Avoidance is when the person deliberately tries to escape any situation or avoid anything that is related to the panic attack. Tim had his first panic attack in the classroom. Since he tries to avoid entering that classroom feeling that it might trigger his attack. He also avoids the gym and any physical activity for the same reasons. Safety behaviors are the behaviors that the anxious individual will do to prevent or minimize the feared catastrophe. For example, Tim may ask a friend or a parent to accompany him at all times so that this person can rush him to the emergency room in case he had a panic attack. It's important to know that therapy, specifically cognitive behavioral therapy, is very efficient in treating panic disorders. Medication can also be suggested if the symptoms are intense and impairing. Therefore, it's important to consult a mental health professional in case you suspect that you or a loved one have a panic disorder.